This dentist left dentistry and went to sell real estate. Okay. Now he's a real estate salesman, but he's going to use the same process that he sold dentistry in. So you and your honey, you're coming, you're going to buy a new house. And you sit down with the realtor and you're all excited and you say, you know, we really like that neighborhood over there by the park. And we're thinking that because it's close to where I work. And he stops you and goes, wait a minute, hold on. Let's stop this thing about, you don't understand. The most important thing about a home is its foundation. Now, there's 3 different types of foundations. We've got cement slab, 4-foot crawl space, or full cement block, full basement. Now, there's 3 different types of cement blocks and 6 different types of cement block joints. Then he shows you a photo micrograph of a cement block joint. And then he gives you a lecture on how to clean your bricks. He says, I'm going to send you my bricklayer to make sure that you can keep your bricks clean. Now, Laura, what, I know this is a ridiculous example, but what would you think if you were that person talking to that realtor?
That the person is, the realtor is not listening to me, not listening to what I want, and spending way too much time educating and not enough of knowing what I'm looking for.
Yeah. Does that sound like a dentist?
Yeah, completely. Yes.
Completely like a dentist. So let's take a look at the real estate sale and compare it to the sale for complete dentistry. Right now, Laura, if we would build a conceptual diagram, conceptual diagrams are kind of like maps for our thinking, okay? Conceptual diagrams let us see how to think. And right now in the patient education model of case acceptance, I call it an inside-out process. That is, we start on the inside of the patient's mouth. We do the exams, CAT scans, x-rays, photographs. We start on the inside. We put a treatment plan together. We sit the patient down. We tell them everything we're going to do. And then they ask, how much will this cost? And then you tell them the fee. Once they hear the fee, Laura, then you learn about their budget. Then you learn about what life events or what health issues they got, or their family situation, or their work schedule. You see, we find out about the outside the mouth issues only after we've done the inside the mouth work. Now, how many times have my clients, have your clients, how many times have dentists invested a huge amount of time inside the mouth, only to find that the outside the mouth factors aren't suitable for that patient to get care? So what I'm going to suggest where we're going in this talk we're having right now is I'm going to suggest that we use an outside-in model. You see, this is what realtors do. See, the realtor isn't going to talk about the house. The realtor first is going to ask you what? What is a realtor going to, one of the first things, Laura, a realtor would ask you if you and your honey were thinking about buying a house. What's one of the first questions?
Your budget, like how much you're thinking.
What's your budget? Yeah. And then what would they ask?
You know, what factors do you want to consider? Are there any outside time frame? How many bedrooms? Like, what are you thinking of?
What neighborhood you want to live in? How soon do you want to move? How close it has to be out to work? You see, all those factors are outside the house. And only after all those factors are kind of decided, then the realtor says, okay, so let's look at some houses that are suitable. There is the key word, Laura, suitability. That's what the concept of complete dentistry needs, is suitability. I mean, we are, so many dentists are just constipated with this attitude about pursuit of excellence that we lost our mind in terms of trying to educate patients into being ready. Education doesn't make patients ready. Now, don't get me wrong. For modest care patients that got a few fillings and maybe some cleanings, sure, we'll educate these patients and let them know about their conditions. I understand that. But I'm talking about the complex care patient who already knows they've got conditions. They know they've got problems. You don't need to, you're not going to motivate them by doing a brush and floss conversation and disclosing solution. conversation with this. I mean, that train has left her station decades ago.